moment, there's imminent crisis at the Department of Child Health of the Korle Bu Teaching Hospital, as the department lacks nurses to care for newborns. Acting head of the department, Dr. Ejuri Saki, has been speaking to JoyNews and says this and many other challenges are making it difficult to effectively deliver quality health care to patients.
Of newborn care, I think one of our biggest shortages is of nurses. We don't have enough nurses to look after the babies. And that is one of the biggest issues that we have, in addition to the background issues of the infrastructural resources and the usual thing about the parents not being able to afford the drugs. For example, antibiotics, some of them are very expensive, and many parents cannot afford because of where we live. There are times when we have donations that have been given already by some charities for such purpose. So sometimes we can call on that. Sometimes some people come in and look for people who need help and pay. Other times doctors and nurses actually contribute money to help a child who they think will do well if only they could get a simple but not that cheap drug. And unfortunately, sometimes the outcome is poor because none of these sources is able to give them what they need. The department, the hospital, the country is all underfunded. So whilst we've got the personnel in terms of doctors and know what needs to be done, it's often the case that the materials that need to be used cannot be afforded by the parents. The parents don't have money to pay for what their children need. And the government or the country is not able to give them either. And that is the reason why we often have to depend on donations to help to reduce the suffering. But you see, there are some things that should be available when you come in. Like if you come for a special X-ray, it should be available, and then you pay the fee that is attached for one person's use of it. So if you come here with $1 million in your pocket and you're looking for something that we haven't provided, then your money will not be useful. So there is a need for the basic infrastructure to be there and for the consumables to be obtained, and then when people come in, they will be able to buy it and go.